Full PPEs must be on, including utility gloves when processing instruments in the sterilization area. Ideally, there should be a counter to the right of the ultrasonic to help with the workflow pattern. Regardless of the size or shape of the instrument processing area, 4 basic rules govern the pattern of workflow. Processing instruments should proceed in a single loop, from dirty to clean to sterile to storage, without ever doubling back. This is an image of the processing flow of a sterilization area. Our sterilization area would be a linear flow, starting on both ends of the wall, which leads to the center of the sterilization area, where 2 blue cabinets are located. This is where sterile instruments may be stored. The dental assisting program sterile instruments are stored in the left cabinet, and the hygiene sterile cassettes are stored in the right cabinet. We're going to use the vertical line on the back wall as a reference. Any instruments on the right of the vertical line are contaminated and still need to go through the ultrasonic. Any instrument set on the left side of the vertical line and transferred onto the towel has been pre-cleaned in the ultrasonic and are ready for packaging. When instruments come out of the ultrasonic, they are pre-cleaned. Pre-cleaning reduces the number of microorganisms that are present by physically removing debris. Keep in mind that the instruments are not sterile. Place the contaminated instruments in the plastic cassettes. Place the cassettes into the ultrasonic. Close the lid. Then start the cycle for 15 minutes. Once the cycle is completed, remove the lid and take out the basket. Set the basket into the sink and rinse the cassettes with tap water. Set the pre-cleaned instruments to the left of the vertical line on the wall. Place the basket back into the ultrasonic. Place the contaminated cassette into the ultrasonic. Since there's only one cassette present, do not start a cycle. The lid is going to be left open as an indicator that the instruments have not completed a cycle. Once the ultrasonic basket is filled with plastic cassettes, a cycle may be started. Whenever the ultrasonic is turned on, the lid must be closed. Closing the lid prevents airborne contamination. Remove the pre-cleaned instruments from the plastic cassettes and set the cassettes back on the right side of the vertical line. On the plastic side of the sterilization pouch, 4 things must be noted. DA for dental assisting, your initials, date of sterilization, and which autoclave was used. Herzing University has 4 autoclaves. On the left side of the sterilization area, we have Minmark 1 and also Statum 1. On the right side of the sterilization area, we have Minmark 2 and also Statum 2. So Minmark 2 would be labeled M2. Depending on which autoclave is being used, you're going to want to make sure that you label your sterilization pouch correctly. Dental assisting instruments are color-coded with a pinkish red band. A basic 3 kit should consist of a mouth mirror, cotton pliers, and an explorer. This is a good example of a basic 3 kit. A mouth mirror, cotton pliers, and an explorer is present. This is not a good example of a basic 3 kit. There is a blue color-coded instrument that should not belong in the pouch, and it's missing an explorer. To package the instruments, place the 3 instruments into a pouch. When inserting the cotton pliers, make sure that the beaks of the cotton pliers are facing the plastic side. To seal the pouch, pull the adhesive off and fold where the perforation is. The seal must be 50% on the plastic and 50% on the paper. If we don't have it divided evenly, we won't have a sealed pouch. You should not seal the pouches like this. The instruments are not considered sterile even if they pass the 3 sterilization monitoring methods. They should be sealed like this. along the perforated line. If the pouches are sealed properly and passed all 3 sterilization monitoring methods, which are physical, chemical, and biological, these instruments inside the pouches are sterile indefinitely until it's opened. Before you start loading the instruments into the autoclave, there must be enough packaged instruments to start a cycle. Do not touch the handle to the autoclave as they're considered clean. Take out an empty tray and place the instrument pouches on the tray with the plastic side up. The sides of the instrument pouches should be touching each other. Do not overlap the pouches, since there should be a free flow of steam within and around the instrument packages. Check the distilled water level before you start a cycle. The distilled water level should be in the green area. If it's in the red area, fill the reservoir prior to starting a cycle. Before starting the autoclave cycle, take off your PPEs. Starting all autoclave cycles must be done with bare hands, since the handles of the mid-marks and statums are clean. PPEs must be removed in the correct order. Disinfect your utility gloves and bring them back to your operatory. Remove vinyl gloves and sanitize or wash your hands. Remove safety glasses, then your mask. If you're wearing prescribed glasses with side shields, you do not have to remove them. Go back to the sterilization area, close the mid-mark by lifting up the handle and push back to lock. Hit pouches and the green button to start. Once the sterilization cycle completes, the door of the mid-mark will slightly open. The drying cycle must be completed before any instruments can be removed from the mid-mark. Check the chemical indicator on each pouch prior to storage.